All right, welcome everyone to our webinar today. I'm going to give everyone just a couple of minutes to log in and to join before we start the content for our webinar today. You'll notice that when you come in, your microphone should be automatically muted, and you should be able to see our screen and see at least us, myself, and our presenter, Brianna Hood. If you have any problems, you can type them in the chat or the Q&A and we can address them. And after everyone joins in about 10 minutes, I'll pop in the handouts in case you didn't receive them via email already. All right. Well, welcome everyone to today's webinar. The title of our webinar is StrivePD, Your Parkinson's Care Companion. This webinar is brought to you in collaboration with Rune Labs, who has brought to us the StrivePD app that you'll be learning about today. And LSVT Global has partnered with Rune Labs, and you'll learn all about that. We're so excited that you've joined us today to learn more. As you're joining, if you could maybe type in the chat who you are, if you are a therapist or a person with Parkinson's or a healthcare professional, we'd love to know who is in our audience today. While you're doing that, I'll just give a couple of introductions about ourselves. My name is Laura Gousset. I'll be your moderator today. I'm a physical therapist, one of the LSVT BIG teaching faculty, and also the Chief Clinical Officer of LSVT BIG for LSVT Global. Featured today is our presenter, Brianna Hood, a physical therapist who is also LSVT BIG certified, coincidentally, and a rock steady boxing coach. But she, most importantly, right now for this webinar, is the StrivePD clinical specialist at Rune. And so we're very excited to have Brianna share information on StrivePD with you today. On the next slide, we'll just take a look at Brianna's biography so you know a little bit about her. I will be reading this for you. She began her physical therapy training at the University of Delaware, where she completed her Bachelor of Science in Exercise Science and Kinesiology, and then she continued on to pursue her doctorate in physical therapy at Rutgers University. There, her passion for neurological conditions grew, specifically her love for working with those with Parkinson's disease. She has clinical experience treating Parkinson's in a variety of settings, including acute rehab, home health, skilled nursing facilities, and outpatient clinics. She is both LSVT BIG certified and a rock steady boxing coach. She joined Rune Labs in 2022 as a member of the patient specialist team. Day to day, she works closely with patients, onboarding them to the StrivePD platform, providing support and creating educational resources for users. She uses her clinical knowledge to assist with updates to the StrivePD product, specifically around mobility metrics and exercise activity logging. She is excited to contribute to data-driven efforts of improving patient care and supporting the next generation of Parkinson's care. And so I have also met Brianna personally. She's a dynamo. You guys are going to love the information that she provides today in our webinar. Before we get to the content, just a couple of disclosures and some housekeeping. I'm an employee of LSVT Global and have a preference for LSVT BIG as a treatment technique, but I won't be presenting today. And Brianna is an employee of Rune Labs and has a preference for StrivePD as a care companion tool for Parkinson's patients, as a DPT, and as an LSVT BIG clinician. And Brianna has no financial relationships to disclose. On the next slide, we'll just see a few webinar logistics. As I mentioned, the microphones are muted right now. Please do keep them muted so there's no background noise from everyone's environments. You can ask questions at any time. We'd very much encourage that. We will have a Q&A time at the end of the webinar today, where Brianna will get through as many of those questions as she can. And if we run out of time, we'll follow up by email. But the goal is to get them all answered today. You should have received the handouts via email. There'll be two of them. One is of the slides, and one of them is a StrivePD handout. If you didn't receive them, don't worry. I'll be popping them into the Zoom chat in about 10 minutes. There will be a survey that pops up on your screen when you exit the webinar today. Please do take a few minutes and answer the survey as we use that information for future webinars. A little bit of information on continuing education units in case you're a therapist joining us. Please note that the LSVT Global webinars are not registered or pre-approved for continuing education units, but there are many states that allow for self-reported CE activity. So just some instructions here. If you're joining us live, you can request a certificate after completion of the webinar by emailing webinars@lsvtglobal.com. And as long as you've attended the duration of the full hour, we'd be happy to send that electronic certificate to you. If you're watching this as a recorded presentation later, you can complete a survey after the webinar. You can find the survey link under the description. And the same is for people that maybe want to share this webinar that are watching it live right now. If you're not sure if your state takes self-reported CE activities, best thing to do is to check with your PT/OT or speech licensing board. On the next slide, we'll just take a look at the learning objectives. We just have 3 of them. In this short hour, we hope that by the end, you'll recognize how the free StrivePD app can help you with your Parkinson's journey, or if you're a clinician or a healthcare professional, help your patients with their Parkinson's journey and help you to provide better care to them. Summarize the types of StrivePD data that are collected or recorded through the Apple Watch and our iPhone. And lastly, determine how the StrivePD data can empower both patients with Parkinson's disease and their healthcare team. So with that, I'm going to turn it over to Brianna, and she's going to take it away. Let's just take a look at quickly who is joining us today before we pass the baton. You've probably already been looking at this, Bree, but we have an occupational therapist from the UK. Welcome, Miriam. That's great. Another OT. Great. Happy OT month to all the OTs out there. And happy Parkinson's Awareness Month to all the people with Parkinson's. We honor you this month. Patricia, SLP, that's great. All the way from Anchorage, Alaska. That's awesome, Frank. We're glad to have you. Welcome, Ed and Lisa. Great. I'm not going to read through all of them because we have so many people joining us today. But looks like a range of healthcare professionals, family members, people with Parkinson's disease, some students. And Patricia, I think you might win the prize for furthest away in Scotland. So that is that's so awesome. I love to know where everyone is coming from. All right, well, take it away, and I'm just going to spotlight you.
All right, thank you. And I even see a few names in there that I recognize. So hello, some of them I know are already StrivePD users. So this is really great that you are joining us today. Thank you for the introduction, Laura. Like she said, my name is Brianna Hood. I am first and foremost a physical therapist and treated Parkinson's, like Laura said, in a bunch of different settings, and I'm LSVT certified. So I'm just thrilled to be here doing a webinar for LSVT today. So we are going to be talking about StrivePD. Rune Labs is the company, and StrivePD is the product. We are a startup company out of San Francisco, although we do work all over the country. We are primarily a remote company. We have about 50 employees or so we're still fairly small, but mighty. And myself, I live on the East Coast. I grew up outside of Philadelphia, and now I live at the Jersey Shore, which is not like the TV show. And I always have to make this disclaimer. But I do talk pretty fast, and I talk with my hands. So I do apologize. I'll try and slow it down for everyone. But this is being recorded, I believe, as well. So if I'm going too fast, there is a recording to listen to. All right, so let's get started. Oops, in here. Okay, so Just as a broad overview, what StrivePD is. So StrivePD is a app for your phone and for your Apple Watch if you have an Apple Watch, and it is completely free. When you download it, there's no subscription, there is no cost, there is no in-app purchases or any kind of gimmicks. It is free, and I just want everyone to know that you can download it right now if you want and play around with it at no cost. We are a HIPAA compliant disease management care tool that enables you to track your symptoms, your medications, write notes, track your activity, all of that within one app. And then you can share this daily Parkinson's experience with your neurologist or your movement disorder specialist, your friends, your family, caregivers. So it's just a really great tool to keep track of everything that's going on, because we know every individual with Parkinson's is different. Everyone has different experiences. So it's a really great app that's tailored to you and allows you to really share your unique experience. So how we came about, this is Aura. Aura is the creator of StrivePD. So she herself has Parkinson's. She was very tired of going to her doctor's appointments with so many spreadsheets and notebooks and papers, trying to, collect all of this data and this information. She was having a challenging time with her medication. She was having a lot of side effects and symptoms and things, and needed a lot of medication adjustments. And she was trying to find patterns and things going on with that. But it's exhausting trying to keep track of all that, especially since you normally only see your movement disorder specialist or your neurologist maybe 2 or 3 times a year. Sometimes people not even maybe once a year. So that's a lot of information to keep track of. So it turns out she also, I believe, had a software engineering background. So she decided to make herself an app, which is pretty cool. I don't think all of us could, do that ourselves. And she named it StrivePD. And it allowed her to keep track of everything in one place and really synthesize that data and be able to share it with her care team. In 2018, we acquired the app from her and then relaunched it with a lot more new features. We're constantly trying to improve our features within the app. And she still sits on our advisory board today. So we do have a patient advisory board, all people with Parkinson's. Whenever we have new features or new things to launch, we make sure that they see them first before we launch them. They try them out. They give their feedback about it. Because first and foremost, we care about the users. We care about those with Parkinson's. We want to make sure that everything we do and any changes or things that we make for the app help you as a user. We also help clinicians and we help care teams, but in the end, it's about the user and it's about improving your experience and helping your journey with Parkinson's. A lot of us also have a deep connection. So I don't, say it lightly when I say that we're not just a, health tech company. Many of us on our team of 50 have someone who personally has Parkinson's in our life. So for myself, it was my grandfather. A few other people have a dad or a mother with Parkinson's. So this mission for us is not just about the business or about the company. It's also about helping these people who we are so close with. So when we did launch, we took a big emphasis on also helping the clinicians as well. So the movement disorder specialists and neurologists in the United States are overwhelmed with the amount of patients that they have. There's a big need right now for movement disorder specialists to increase the number that we have, because we know that there's almost 1 million people in the United States with Parkinson's and not nearly enough doctors to be able to see them. So these physicians only get to see their patients maybe 2 or 3 times a year. So we wanted to help incorporate a way for them to be able to monitor their patients outside of the clinic. You probably all know that maybe your visits sometimes are only 20 minutes, 30 minutes if you're lucky, to discuss everything with your doctor. And during that time, you might have to do some tests and measures and all sorts of things. So it can be really tough to have these conversations about certain symptoms or things that you want to talk about because you just don't have time. So one of the really great things about StrivePD is the doctor can actually see everything that you're putting into the app and all the data the app is collected if your doctor's part of StrivePD. So this allows them to look at everything prior to your appointment, and then your conversations can be a lot more streamlined when you do go see your doctor, and allow you to get to like the most important things and the things that you need to look at, whether it's changing your medications due to symptoms or changing your DBS settings, those kinds of features. StrivePD has definitely helped so many physicians find patterns with medication and symptoms. And also, like I said, the DBS setting, so the deep brain stimulator. A lot of times it takes multiple visits to get the settings and the adjustments correct. But with the power of data collection, they're better able to make clinical decision-making a bit more accurate and not have to spend as many visits to find that right sweet spot for you. So here's two more pictures of what it looks like. So the first section here, we have the iPhone and the Apple Watch. So this is for a patient or one of our StrivePD users. They would get all of their data on their iPhone and be able to track their symptoms and all of the things that are collected from StrivePD. And then the clinician gets the clinician portal, which is like an online portal that they log into, and then they can click on their patient, whichever one is, they're wanting to look at, and be able to see all of their metrics as well. So there's a lot of tracking apps out there for, all sorts of diagnoses like migraines and MS, OCD, and for Parkinson's. But what sets us apart as a Parkinson's care companion app is the use of the Apple Watch. So in June of 2022, the Apple Watch got FDA 510(k) clearance to track two things for people with Parkinson's. It will track your tremors and it will track dyskinesia. So those two things, just by wearing the Apple Watch, will be automatically collected, the amount of time that you're having tremor and dyskinesia every day. This information will populate onto your app, so you'll be able to see it and keep track of those two symptoms. And then it will also collect onto your clinician's portal. So again, this is a really great feature. If medications, you're noticing your tremors increasing, or certain times a day, it's a lot more bothersome than other times a day, your doctor may be able to make some adjustments based off that data to your medication schedule. And same thing with dyskinesia, which sometimes occurs due to medication side effect. They might be able to spread out your medications over time better, maybe do half pills based off of the times that dyskinesia tends to occur. This is just a really great tool, because before you would come in and say, I think my tremor is getting better, or I think it's getting worse, but it was very hard to tell because it's not something you're fully concentrated on all day long. No one wants to just be thinking about their tremor all day. That's exhausting. So the watch does it for you. The watch collects all that information for you just by wearing it. There's also a lot of other things that we're going to get into that the watch can collect. But I do want to say you do not technically need an Apple Watch to use StrivePD. So I don't want people who, don't have a watch saying, oh, this is useless to me, because it's not. You can still use StrivePD with the iPhone only version. There are plenty of things that you can track, that you can take notes of, your medications you can input, and still have some really great data and information to send to your clinician. It's just that the Apple Watch is a great feature because it's just a passive thing that you wear, and it collects that tremor and that dyskinesia data. So like I said, the Apple Watch will automatically record your symptoms via the Apple Watch and the StrivePD app. Then you can learn from some patterns in your behavior and manage your condition. So maybe you notice that, days that you do exercise, your tremor looks so much better the following day, or maybe a few hours later. Or maybe you start to notice, oh, my medications, I notice that I start having a big spike in tremor an hour before I'm due for my medication. Maybe I should talk to my doctor about, adding an extra little dose as needed for those times that my tremor gets really bad. This improves your communication with your care team. And then if you're movement disorder specialist has access to StrivePD. They'll be able to see all your StrivePD data in one place prior to your visits. Even when you're not in the clinic, they'll be able to make sure they're keeping some tabs on you. So I talk a lot about the Apple phone and the iPhone and the Apple Watch. So unfortunately, some people will be bummed out, but we are only with Apple products. So Androids, Samsung, Google phone. Unfortunately, StrivePD is not available on those phones or those wearables. So like the Garmin, the Fitbit, the Oura Ring. Unfortunately, we are just with Apple products, and there is a reason for that. And I will get into that, I think, on the next slide. So yes, it's the iPhone and or the Apple Watch. There also is certain iPhones that are compatible. If you have a very outdated iPhone, unfortunately, the app won't work accurately on it. So the StrivePD platform, you can see up here, is compatible with the iPhone SE second generation or newer. So the SE, the 12, 13, 14, 15, I think we're up to 15 now, are all compatible. If you have an iPhone 8 or a 10 or anything lower than that, then unfortunately it's not compatible. That the platform is not compatible with your phone. The reason being is that those phones eventually can't update to the newest software. Apple does this on purpose. They do it so, your phone can't update and therefore your apps stop working. And that's a great business model for them because it forces you to have to update or get a new phone, which I'm sure helps them business-wise. But unfortunately, when you can't update your software, then it makes your apps not work on the phone. So an iPhone SE second generation or newer. And then for the Apple Watch, it's the Apple Watch Series 5 or newer that works with our platform. So we talk a lot about data. And today, if you read a newspaper or turn on the news, everything's about data and AI and all of this. So what exactly is this data? How are we using it? Where does it come from? So we have three main buckets of data that we grab and put onto your phone so that you can see it on the StrivePD app, and then also on the clinician portal so your doctor can see it. So the first one is the Apple Health Kit data. If you're already familiar with the Apple iPhone, if you already have one, you might have noticed that there's a little app on there called the Health app. It's white with a pink heart. In that, you'll see a ton of information about your health. You'll see like your gait metrics, like your walking stability and your step length and your walking speed, which automatically gets captured by your phone just being in your pocket. If you have the Apple Watch, you'll also see information about your heart rate, your sleep, activities burned, all of those kinds of neat features. So this is already on your phone, but we take it and put it onto the StrivePD platform and put it onto the StrivePD app as well, so you can see it all in one place. The Apple Watch does the activity via that workout app, the sleep and the heart rate metrics, and also will automatically detect hard falls. I do stress that it has to be a hard fall. If you already have an Apple Watch, you might notice this. If you have a slight fall where you're kind of sliding out of a chair or something a little bit more gentle, the Apple Watch will not pick up that you're having a fall. But if you do have a hard fall at home or out and about, the Apple Watch will alert you that it detected a fall. And I believe if in 2 minutes you don't swipe away on your watch saying you're okay, it will send your coordinates to EMS, to the local EMS so that they can find you and assist you. And if you have it set up for your emergency contacts, it will also notify your emergency contacts. So it is a really great tool, not just for StrivePD, but if you live alone or you're a high fall risk, it can be a nice tool to have. There's been several stories about people, falling, getting knocked unconscious, and then EMS being able to find them and assist them. It also has crash detection now. So if you get in a car accident, it can detect that as well, which is pretty cool. The mobility and the gait metrics, you can see they're bolded. Anything that's bolded can be used for the iPhone only version, so you don't need the Apple Watch. So a lot of people think mobility metrics come from the watch, and they do not. They come from the phone. So even if you just use StrivePD with your phone, you'll still be collecting those mobility metrics, and your doctor will still be able to see how your walking speed is, your step length, your steadiness. So a great feature to have even if you don't have the Apple Watch. The second box there is the Apple Movement Disorder Kit. This is why we're only with Apple products. At this time, Android products, so like Samsung, Google, their wearable devices like the Fitbit, Aura, Garmin, don't have this. This is the FDA cleared ability for the watch to track tremors and dyskinesia. So we really hope that these other devices start to come out with something similar. But right now it's only Apple that has the ability to track tremor and dyskinesia in people with Parkinson's. So that is why we are with only Apple products at this time. The last box there is patient self-reported data. You can see that all of these are in bold as well, meaning that they are collected with, even if you're just using the iPhone only version. So that is your medication schedule and your adherence, your self-reported symptoms that you manually input into the app, activity. You can manually input that into the app. If you have a watch, it will automatically capture activity, or you can use the workout app on the watch. But if not, you can still put in that you're doing your LSVT exercises, or that you're, going to physical therapy, going for a walk. You can put those in manually. And then also there's a note section. So you can write notes. Your doctor will be able to see them. They will be time stamped and date stamped. So here's a few pictures of, or some screenshots of what the app looks like on the phone and on the watch. So if you look all the way over to the side here, this is like our home page, or what we call My Day. You'll be able to see that there is a chart that shows your tremor and your dyskinesia data. This can also be opened up. This is showing the week, so you can see the fluctuations throughout the week, but it can also open up and you can see day by day view. So you can actually see hour by hour how much your tremor and dyskinesia changes throughout the day. And I will show you another picture of that coming up. If you come over all the way to the other side, it says, what do you want to log? So we like to call this our little toolbox. It's a bunch of things you can put into the app. It's not necessary. It's not, mandatory, I should say. But it's if you want to start reporting things and keeping track of certain symptoms or things that are bothering you, and you want your doctor to know about them, you can use this little toolbox and input whatever you would like. We try to make everything very low burden user experience. We do know that some people might not feel as tech savvy as other people, and that's okay. Again, we like to test everything, make sure that it's easy for you to use. We do understand some days the dexterity can be difficult. Tremor can be very challenging to navigate, pushing buttons on a phone or trying to type things. So we do try to take all that into mind and make things as little amount of clicks as possible to input something. So if you're taking a look at this toolbox here, what do you want to log? The very first one says symptom or side effect. So that is anything like a symptom of Parkinson's or a side effect from your medication. It populates a very long list of all the common ones. You can also add your own personal one if there's something specific to you. And you can log, anxiety. You can log balance issues, leg cramps, facial pulling, some people experience from DBS. So you can log those things each day when they occur and be able to keep track of that. The second one is medication or supplement. You can one time just put in your medication schedule. If you take your medications at, typical increments, so like carbidopa, levodopa, if you take it every 3 hours, you can input those times and it will populate your medication schedule every day. You can also opt in to have an alert. So it will alert you either on the phone or on the watch to, hey, it's time to take your medication. So that definitely helps with some compliance, especially if you're forgetful of taking your meds sometimes. And it also makes you a little more accountable because then you have to go in and check off that you took your medication that day. The next one is influence. That is anything that affects your symptoms. So different types of food, stress, travel, getting a cold, COVID, all of those things can really have an effect on your symptoms. So it's kind of anything that does that. You can also input your own personal one. And I always love to tell this story. We have a gentleman who input his own personal trigger, you could say, or influence that makes his symptoms worse. And it was anytime his mother-in-law comes to town, his symptoms get worse, which, hey, it happens. I just told him, don't let her see that on your app. So whatever you want to do, it's very personalized and customizable to have, keep track of those things. The next one is DBS. The iPhone and the Apple Watch are in no way connected to your deep brain stimulator. You probably have your own little device or other kind of phone or thing that helps you with your settings of your DBS. It's not connected to the iPhone or Apple Watch. But if you want to keep track of what settings that you have your DBS on, you can put that in this little log here as well. Then we have a Note. So Note is just a free space. You can type anything you want in there. It will be time stamped and date stamped. And again, all of these things that you're inputting, your physician will be able to see as well if they're part of StrivePD. So the more you put in, the more information they have, the better. But again, it's not something that you have to be like a slave to. You can just do it as needed for the different kinds of things that you're experiencing each day. The very last one is Motor Diary. This isn't yet available, but this will be for tracking your on and off times. We also incorporate Siri into our app now. So you can record medications and symptoms using Siri. And you don't even have to open up your phone to do it. So that's a nice feature to have on days where maybe dexterity is a bit tougher, navigating the buttons is a bit tougher. And then also I should mention that when you input a note, there's also a little microphone so you can dictate a note instead of having to type it if you would like. So onto my favorite topic, being a physical therapist, is the activity logging feature. So we did a big revamp on activity because we do know how important that is for people with Parkinson's. And we are especially happy because we have branded the LSVT logo in our app as well. So we want to enhance activity logging to make sure that you engage with your daily routines and your home exercise programs. That's always a pain point, making sure everyone's doing their home exercise program. And our primary objective is to encourage you to engage in healthy activities, comprehend the impact of exercise on your day-to-day well-being and your disease progression. So again, if you're tracking symptoms or you're wearing your watch and getting that tremor and dyskinesia data, you can see the impact right on your phone of what exercise can do for your symptoms or how it can make you feel better. So that's just like a great way to have that correlation and be able to understand just how important exercise actually is for your symptoms. So we do have LSVT in here now, so you can go ahead and log that. Whether you have the Apple Watch or not, you can log this and put in the time or how long that you did those exercises for. There's also a link here. It's not showing up on this picture, but there's a link here as well. So if you haven't done LSVT or maybe you move to a different state, there is a link there to bring you to the LSVT website, and you can find the closest certified clinician to you by searching your zip code. Here's just a couple more pictures. So here is a good picture. Actually, I'm going to probably go on to the next one and show you the next picture. But there is something called the streak for the activity section in our app. So it is how many times you've consistently or consecutively logged an activity in the past week. So you can see, this person's on a 9-day streak. They've done 9 days in a row of activity. And then it will also say their longest streak. So their longest without breaking it was 18 days. This can get very competitive, we've seen, but it's a great motivator of being like, hey, I want to do something every day. Now we do know that, There are days that you need rest, and that's completely fine. You can log a rest day. It won't break your streak. But even if you're just going for a walk, doing some stretching, you can log that and continue that streak. Here's the picture I wanted. So here is what the day view looks like. If you have that Apple Watch and it's collecting the tremor and dyskinesia data, you'll be able to see your day. So it will tell you your total amount of tremor that day and your total amount of dyskinesia that day. And you'll be able to see the fluctuations on the graph in the different hours of the day. So you can really start to see exactly what times a day you tend to have the most tremor or dyskinesia, and how long it lasts throughout the day. The nice feature is too, if you have your medications set up in our app, you'll see your little medication pills there. If they're dark, it means that you took that med already. If they're gray, it means that it's an upcoming medication you haven't taken yet, or you did not take it. And that's nice because you'll start to see the correlation of, oh, okay, I took my medication when my tremor was really high. And then after my medication kicked in, also my tremor started going down. So you can start to see those correlations. You can also see any activity that you put into the app. So, oh, I did my LSVT BIG exercise around, 2 o'clock in the afternoon. And I noticed that, at first I had a bit of a spike of tremor because it was a very intense exercise. Sometimes your tremor gets worse after exercise. But then I see it goes down later in the day and I felt a lot better. So again, just starting to see those patterns and recognize what makes you feel better and what makes you feel worse. This is a new and exciting thing that we just put together and got sent out on April 1st is these really nice new insight reports. So whether your doctor is part of StrivePD or not, whether you have an Apple Watch or not, it doesn't matter. If you download StrivePD onto your phone and create your account, you will get one of these reports emailed to you to whatever email you use to sign up, and you'll get it sent to you every 4 weeks. So about once a month. Every 4 weeks, you will get a nice report with everything about the data that you have input into StrivePD or the data that was collected passively through the Apple Watch or through the phone. It will show you the most recent 4 weeks in comparison to the last 4 weeks. So basically this month compared to last month. So you can start to see any kind of comparison or any kind of changes that occurred over those months. The first section will be the from your watch section. If you don't have a watch, this will just be blank. But if you do have a watch, you'll be able to compare your tremor from this month to last month. And, maybe you started a new medication or maybe you started a new exercise routine. You'll be able to see the effects of how that changed your tremor. You'll also get the same exact thing for dyskinesia. So comparing last month to this month and be able to make those comparisons. Then at the very top is symptom log. That's any symptom that you manually input into the app that the watch and the phone don't capture on their own. So like I said, balance issues, anxiety, leg cramps, any of those kinds of symptoms that you input will be here, and you'll be able to see how many times you logged it in the past 4 weeks or in 4 weeks compared to the previous 4 weeks. So seeing if that logging, if that symptom is getting better or getting worse compared to the last month. The next two ones we're going to zoom in on because again, love activity. So we're going to talk about it for a minute. This section is going to be showing you how much activity you've been doing. So whether you're using the watch to do your workouts, using the workout app, or if you're just manually inputting it into StrivePD, those workout minutes will show up here. So you'll be able to see the dark blue, which is the most recent 4 weeks, compared to the light blue, which is the previous 4 weeks. You'll be able to see each week how many minutes of activity you've done. So the goal is 150 minutes per week, and that is because that is what's recommended by the Parkinson's Foundation and the APTA for people with Parkinson's. So 150 minutes a week. You'll see the green goal line, and you'll see if you're hitting that goal or how far above that goal you've been getting each week. You'll also be able to see a breakdown of exactly what exercises you have been logging, and then the total time you spent doing those types of exercise, how many times you logged it, And then right now it says average heart rate. This is, again, only if you have an Apple Watch, because the watch can detect heart rate. We will be revamping this to have it instead give the minutes that you are in 60% or higher of your heart rate max. So we know that exercise is important, but more and more research is coming out that specifically moderate to high intensity exercise shows the most improvement of symptoms and the most change within people with Parkinson's. So going for a walk is great, a leisurely walk, but doing a leisurely walk in comparison to a really intense exercise, there is a difference between those two types of activities. So we do want to show people when they are 60% or higher of their heart rate max, it's considered moderate exercise, so that or higher. We want to be able to show them the minutes that they're getting of that each 4 weeks, because that is a very important thing. And then maybe you'll be able to see what activities get your heart rate up to where it should be. But again, that's just for if you have an Apple Watch, and that will be coming hopefully soon. We are working on that right now. The next one is mobility. So again, just to emphasize, mobility comes from the phone. So even if you don't have the watch, you'll get this great data about how your walking is. And your doctor will also be able to see this as well. So you'll be able to see your step length, your walking speed, and something called double support percentage. That's how often both feet are on the ground during the walking cycle. Typically, when you're walking, one foot's on the ground as the other foot is going forward in the air to make the next step. So you actually want this number to be lower. Lower is better for double support percentage. And if you have a very high double support percentage, that's more indicative of someone who's shuffling their feet because they're not lifting enough and getting on that 1 foot stance. So these numbers are really great. You'll be able to see the comparison to the previous 4 weeks. So if your walking speed is starting to decline or your step length is starting to decline and you need to start stepping bigger, like you learn in LSVT, step big. So it's a great reminder and a great way to start tracking that progress. And even if you're, out of physical therapy, you've been discharged for a couple months, but you start to notice, ooh, my walking, I can see based off of these metrics that it's starting to decline. Maybe then it will trigger you to say, maybe I should go back to, my PT and get a few more exercises or start to, do some more LSVT BIG exercises. So, and I should also say these reports are emailed to you. They do have these nice clickable links. They're emailed as a PDF. And you can click on these links under each of the sections that say watch our video, and they have educational videos. So what is mobility? It will go through all the different mobility features and what it means, activity, different things like symptom logging, the difference between tremor and dyskinesia. So there are some very nice educational components as well. I definitely encourage you to watch those videos. Again, this is a PDF. You can print it out. So even if your doctor or your care team is not part of StrivePD, you can print this out and bring it to them. It could be a really great resource that they could utilize as well. And then maybe they'll be interested in joining the StrivePD team. Okay, so I talked a lot about neurologists and movement disorder specialists in the United States and being part of StrivePD. So right now, these numbers are a little off. They should be a bit more updated. It's more around 200 clinical sites in the United States right now that we're associated with, and about, I'd say 300 clinicians or so, movement disorder specialists and neurologists in the United States who have access to StrivePD. So you're probably wondering, well, how do I know if my doctor is part of StrivePD? So the way to find out is just to go to our website and register with us. Again, you can download StrivePD and use it regardless of if your doctor's part of it or not, because you'll still get some great information. You can use it for your own journey. You can print out those PDFs and give them to your doctor if you would like. So don't feel like you can't use it if your doctor's not part of it. But if you want to know if your doctor is, just go to strivepd.com. You can see that link right there and click register. It will ask you some questions like where you get your care, who your neurologist or movement disorder specialist is. And then you'll get an email from us in usually like 2 to 5 business days saying, yes, your doctor is part of our program. Here's the next steps to take. Or we're sorry, your doctor's not part of our program, but if they're interested, this is how they can contact us. So if you really do want your doctor to be part of it, or you want them to know about this, please spread the word. We love that. And you can let them know how they can get in contact with us and become part of StrivePD. So here's just a couple quotes from some of our users. Deborah Z said, the fact that Strive gives you a notation where you can make a note about anything you enter was very useful. I could tell the doctor explicitly when it occurred and how long it would last. It was also a good emotional outlet to be able to talk about what was happening through writing. Dave B said, I realize I'm learning more about my tremors, how it works and what sets it off. It's not regular. I'm learning about the external factors that might affect the tremor. In other words, if I sit down and watch TV for an afternoon, the next day I go for a hike in the afternoon, how it affects the tremor. So again, it's just a great tool for you to be able to kind of have more of a handle and understanding of what makes your symptoms worse, makes them better, and how you can improve your day-to-day life. So here's a QR code. You can scan this or just go to StrivePD to register and see if your doctor's part of the program. And then just can download StrivePD anytime. Again, even if your doctor's not part of it, even if you don't have an Apple Watch, feel free to go to the App Store on your iPhone and just search StrivePD. And again, it's free. So please try it out and let us know and give us your feedback. We do have an email here, support@runelabs.io. That goes to myself and 3 other patient specialists. Our job is to support you. So if you have any questions, concerns, we have tons of video resources, a user guide, all sorts of things to answer your questions and assist you with learning how to use StrivePD. Right, and now over to Laura.
Okay, well, thank you so much for that jam-packed informational webinar on StrivePD, Bree. That was phenomenal. Some questions have already come in through the Q&A, which is great. Thank you. We'd encourage you to keep rolling those questions in so that we can answer them. Or you can raise your hand if you prefer not to type. There's a little hand icon that you can click, and then I'll just have to find you and unmute your microphone. If you prefer or you have a more private question, you can always email us at info@lsvtglobal.com and we can forward any questions about StrivePD to Brianna. And as you're getting those questions rolling in, just want to alert you to a couple of upcoming webinars, whether you're a clinician or a person with Parkinson's, and I think those are on the next slide. If you want to advance the slide, Bree. Yeah. If you're a clinician, we have a webinar on Monday, April 22nd on RTM, Remote Therapeutic Monitoring. LSVT Global has partnered with a company called Weeby, which used to be called Physiotech, and it makes it really, really easy and is very, very helpful for patients that go through the LSVT program to continue to support them after their month of treatment. If you are a person with Parkinson's, we'd invite you to come to our public or our community webinar, and that's shown on the next slide. I believe that is April 24th at this time of day, 2 to 3 p.m. Eastern, and we're going to be addressing the topic of freezing challenges in Parkinson's and how LSVT can help you, whether you have freezing of speech, yes, it is a thing, or freezing of movement. And that's a free webinar. If you can't join us, both of these webinars will be recorded and available to you. You can register at blog.lsvtglobal.com and go to the events section to find our upcoming public or community webinars. All right, so this is just some information about the survey that will pop up at the end, and this is on your handouts as well, which I uploaded to the chat. But let's take some time. We have about 12 minutes remaining of our webinar to get through some of the questions that came today, and I appreciate everyone's questions. The first one that came in is from Lauren, and she said, what are the PROs or pros you track to help patients? And that may have been addressed. I'm not sure what PROs exactly means, but is there anything
I think
additional you want to add there?
Sure. It's I believe it's patient reported outcomes.
Okay.
So yes, the patient reported outcomes you track to help patients. So like I said, there's that toolbox where patients can input any kind of symptoms they're having, any kind of influences that they're having. And then in that insight report that they get every 4 weeks, they'll be able to see how many times that they have been tracking that throughout the month. They can also write notes. So if they want to expand on like the times that it's occurring, all of that information can be on there. It will also be on the clinician portal for the physician to be able to see. And on that clinician portal, it will be on a timeline. So they'll be able to see the times that those patient reported outcomes are being logged. So that way they can also correlate it with maybe their medication schedule or maybe with, their DBS settings during that time. So there's hundreds, I want to say, of patient reported outcomes that can be manually put into the app. And then there are the passive ones. So the mobility metrics are passive. That's just from having the phone in your pocket. And then the Apple Watch ones are passive as well, just from wearing the watch.
All right. I think it's really mind-blowing how much data can be captured, whether it's automatic capturing or manual entering. It's just amazing. Okay, this is a great question. Does the Apple Watch need to be worn on the arm that's affected by the tremors if I currently have tremors only on one side?
It's a great question. I feel like I always forget to put this part into the slideshow. It always gets asked. I need to just put it in there. But great question. The Apple Watch, based on the validation study, should be worn on the side that you have the most tremor or dyskinesia on. So the side you have the most symptoms on is the side that you should wear the watch. Some people have reported that they sometimes get tremor or dyskinetic movements in their foot or in their ankle. And they say, should I put my watch on my ankle? But unfortunately, that is not what the FDA clearance and the validation study got approval for, only for the wrist. So if you do have a tremor in the foot, it probably will not be picked up by the Apple Watch. That is a little bit of a limitation since it is just a watch. It's going to take more of the upper body tremors or the upper body dyskinetic movements are going to be picked up by the watch. So it's not perfect, unfortunately, but we also don't want to strap you on with 4 different watches on part of your body.
That would be an interesting sight.
Yeah.
Okay, thank you. Next question is from Frank. How would my Parkinson's MDS access the Strive PD portal, and is there a cost? So I think you addressed they could contact Strive PD, but what about the cost? Is there a cost for physicians?
Great question. So yes, you can first off register with us on our website, strivepd.com, to see if your doctor's already part of our program. If they are not, you will get an email in a few days telling you exactly how to get your physician involved if they're interested. As for costs at this time, and I just want to say at this time, there is no cost to physicians to utilize our platform. They would just reach out to us. We would give them access and we would train them on it as well, give them some training materials. Now, this is only for movement disorder specialists and neurologists. This, unfortunately, is not for a physical therapist just yet or occupational therapists. We will be doing a pilot study for any PTs that are out there right now. We're doing a little bit of a pilot study to see how we can incorporate this into PT clinics as well as a remote therapeutic monitoring system for your patients with Parkinson's. If you are interested in being part of that pilot, it's 6 months long. Please send me an email and I can put my email in the chat for any PT who is interested. But at this time, there is no cost to the movement disorder specialist or neurologist.
Excellent. And I think the point that you made earlier too is that even if your physical therapist, neurologist, doctor, whoever isn't part of it, you can always print and share the reports with your healthcare provider and kind of show them the things that you're tracking, you're recording, which as a PT, I would love that to have a printout and say, hey, you did your exercises every day this week, or, there's so many things that I think any healthcare provider would be interested in seeing. Okay, next one. Would you mind going back to the slide that shows the different types of devices that Apple Watches that it's compatible with? I think there were a couple of questions that came in regarding that one. We'll just let that
This, I believe.
yeah, we'll just let that hover so that people can look at that again. And again, the handout is in the chat, the Zoom chat. If you scroll up a little bit, you should see a little PDF icon that you can download this, save this to your computer, or if you want to take a quick picture right now with your phone, whatever is easiest for you. Okay, here's another one. Are you over in the UK? Yes, we have a UK. We have someone from Scotland here. Is there plan to commercialize in the UK or EU?
So right now we are only in the United States. We do hope as we grow to expand. And our first two areas of expansion would probably be Canada and the UK. Whenever you're going into another country with any kind of medical device, there are a lot of different, I guess, red tape and things you have to go through because FDA regulation can be a bit different from the NHS, what they regulate. So it is a bit of a process. And right now, because we are a small company, we are just keeping it in the United States at this time. But I will say we have interest, so much interest over in the UK, as well as in Canada and the EU. So we are hopeful to do that. We do have a few exceptions with certain studies because we do help with some research studies, pharmaceutical companies, clinical trials. So sometimes you may hear of it being over in the EU or in Canada for those kinds of studies, but to the broad public, it is not available at this time.
All right. Well, we'll have to wait a little longer if you're not in the United States. Oh, here's a question. Will the watch be covered by insurance?
That's a great question. So at this time, I don't believe it is. I think some people have tried doing like an HSA, their health savings account, or other ways of doing it. We do hope again in the future that since this can be used as a medical device for people with Parkinson's and can be cost savings in the future because it's helping, detect changes in mobility before someone falls, or it can help, maybe keep you out of the hospital because your doctor is able to monitor you because you have an Apple Watch. We're hoping that in the future, these insurance companies will see the cost benefit to having this device and be willing to pay for it or be willing to at least discount it. But at this time, I don't believe it is covered by insurances. And again, we don't, as a company, we don't get any profit from Apple. Apple does not pay us anything. I wish that they did because a lot of people have converted to Apple and iPhones because of this app, which is great to hear. But yes, at this time, unfortunately, it is not covered by insurance. I will say, there is a cost to an Apple Watch. You can get refurbished ones that are a bit, on the less pricier side, as long as it's an Apple Watch 5 or more recent. So definitely check out the refurbished ones because you can get a good discount with those.
Mm-hmm. Yep. And if your birthday or Christmas is coming up, it's a great thing. It really is a great tool.
Yes.
And you brought up a good point. This really is a tool that purely is to be a helpful tool. LSVT Global doesn't get any kickback or money from it at all. We just want to really help people to monitor their symptoms, monitor their activity, their exercise, and ultimately have better care for their Parkinson's disease. A thank you from Frank. Thank you, Frank, for joining us. Next question, how do you deal with lack of energy or tiredness and the fact that my PD person should exercise regularly? Great question. I think we could both answer that as a therapist, but since you're the presenter, I'll turn it to you, Bree.
Sure. Yes, that can be a big burden, and not just for Parkinson's, but you see that with so many different diagnoses. We can say pretty confidently that a exercise routine that is consistent can actually help with your energy levels long term. So definitely starting up that exercise program or that routine can be the toughest challenge. And again, that's with a lot of different diagnoses. But in the end, you will start to realize all of the improvements that you're having in your rigidity, improvements that you're having with your, even things like cognition, with your tremor, with your dyskinesia, with your walking. That's going to make you not only feel better, but also have more energy. So it seems counterintuitive to be expelling energy to get energy,
Yeah.
but it is a thing that has been shown and proven to help, especially with this population.
Yes, totally. And, Bree and I are both PTs who have spent a fair number of years working with people with Parkinson's disease, and the struggles with apathy and depression, anxiety are real. And that's one of the very good reasons of really getting involved and engaged with a physical therapist that has expertise, because you can lean on them. They will energize you, be your coach, and help you get through that first week when you are like, oh, I don't want to do this. I don't want to be there. And then the tide starts turning and you're like, wow, I really actually am starting to feel better. Okay, I think we have just a couple last questions and then we'll wrap it up for today. Could this app be used for alternative diagnosis like Lewy body dementia, MSA, Parkinsonism, other syndromes, or is it limited to idiopathic Parkinson's disease?
It's a great question. So the validation for the Apple Watch was with idiopathic, your typical Parkinson's disease. You certainly could utilize it to, keep track of symptoms and other things that are Parkinson's like. But again, that validation study for, use of the watch for medical decision making is based off of the idiopathic Parkinson's disease. So just keep that in mind. But yes, I don't see why it couldn't be used for other Parkinsonisms if your tremor and dyskinesia is showing through as well with those.
Okay, great, great. And for those of you that got to go, thank you for joining us. The survey will pop up as soon as you exit the webinar. Last question of our webinar today. Do you have figures on how much faster or better StrivePD supports personalizing care?
Ooh, this is a great
That's a good
question.
question.
So we actually are doing a pilot right now. That is not the physical therapy one I spoke to about yesterday or earlier. But the pilot we're doing is with Kaiser in Northern California, where we are actually doing somewhat of an experiment of the individuals who are being seen by movement disorder specialists, who are on StrivePD versus those who are not, to be able to start making those comparisons of how an improvement with their medications or an improvement with their DBS settings or improvement with keeping them out of the hospital or being at a lower risk of falls has happened due to just being on StrivePD and utilizing it with their healthcare professional. So we don't have those statistics right now because it is going to be an 18-month study to really get some core data to show how much this can help. I can say anecdotally, we've had a lot of people telling us how much it has improved the quickness or fastness of changing a medication schedule or being able to solve their symptoms or improve their symptoms quicker because of the data that they had in front of them and that data that their doctors had in front of them. But we don't have that percentage yet, but we hope to be able to have that and something to be published, whether in a white paper or research paper, to show the world.
Awesome. We are going to close out our webinar today. Brianna, thank you so much for taking the time to share information about what StrivePD is. I think you're going to get a lot of emails from people wanting to learn more. And I would say if you're interested, download the app and, kind of start playing around with it. That's really the best way I found, is to start experiencing it yourself. And Brianna and her team are there to really onboard you, support you. So until we see each other next time, thank you all for joining and have a great week, and happy Parkinson's month and happy OT month.
Thank you.